Phenylketonuria, also known as PKU, happens when the body cannot break down excess amino acids. Patients with PKU have an excess amount of phenylalanine, a protein, and cannot destroy it. They lack the PAH gene, which helps destroy phenylalanine. This affects about 1 out of 15,000 people in the U.S.
Phenylketonuria is a genetically inherited disease. Its inheritance pattern is known as autosomal recessive. This means that if both parents are carriers of the disease, there's a 1/4 probability that their child will be infected, a 2/4 probability that their child will be carriers, and a 1/4 probability that the child will not be affected by the disease at all. If only one of the parents is a carrier and the other is not, the child will not be affected at all.
Infants born with PKU typically won't show any signs until a few months after birth. Children with PKU may show signs of several neurological disorders such as intellectual disability, hyperactivity, psychiatric disorders, seizures, social or behavioral problems. If the disease is untreated, some brain damage may turn permanent.
To determine if a child has the PKU disease, a blood sample is taken from the child's seal about 2 days after birth to see if the child lacks the PAH gene. Before having a baby, it is important to get an enzyme assay for you and your partner to determine if you are a carrier for the PKU.
Although there is no known permanent cure for PKU, patients with the disease can take a certain diet that has a low intake of proteins. Patients with PKU already have a high amount of phenylalanine. A diet with low proteins can help reduce that amount. The FDA has approved a drug which can reduce the amount of phenylalanine and give the patient more freedom to eat what they choose.
Fortunately, if a person infected with PKU follows a specific diet, they should have the same life expectancy as anyone without it.